My name is Lindsay Finney, and I'm the coordinator for the Children's Advocacy Center of Pierce County, otherwise known as the CAC. Thank you so much for your participation in Marybridge Children's Courage. My team and I are so thankful for your dedication and commitment to supporting child abuse prevention and treatment services at Marybridge Children's. The CAC at Marybridge is a partner in a multidisciplinary team of professionals who work together to serve child victims of abuse and their families.
The CAC is really the coordinator with our multidisciplinary team, which we call our MDT. And so they're the ones that kind of provide wraparound services to the children. The partnership has greatly impacted for the better our cases. They're actually, we have protocols. They're monitoring the protocols to make sure everybody at all stages are handling the cases appropriately, are handling them correctly. They have trained medical providers who are providing medical exams, medical services. They have trained forensic interviewers, as do our office, and they're the ones that are interviewing the children, making sure that it's done in the correct way, making sure that it's done in the best environment possible. And really, they're the ones that are making sure that the law enforcement, CPS workers are getting the best possible information from the children so that they can go forward and investigate cases.
The CAC model was developed in the 1980s in Huntsville, Alabama, by a former district attorney and congressman, Bud Kramer. Mr. Kramer had a vision for a more coordinated team approach to address the needs of child abuse victims. His vision led to systems who were previously unaccustomed to working together, such as law enforcement, child protective services, prosecutors, mental health professionals, medical professionals, and victim advocates, to begin collaborating to meet the needs of child abuse victims and their families. The CAC model is based on the notion that no single agency can meet the needs of child abuse victims on their own. While the CAC model was initially created to specifically address child sexual abuse, it has since evolved to serve victims of physical abuse, witnesses to violence, and commercially sexually exploited youth. When a child comes to the Children's Advocacy Center of Pierce County, they are coming to a safe, neutral place where a team of professionals collaborate to make decisions. They meet with a trained child interviewer who will talk to them about the abuse that they have experienced or witnessed. During this interview, a CPS social worker and detective observe from another room. Following the interview, the child can meet with a medical provider to discuss any worries they may have about their body. The child's caregiver meets with a social worker or victim advocate to learn about the investigative process and to receive critical support and resources. Prior to leaving the CAC, the child will be referred to a counselor who is trained in providing trauma-informed care so they can begin their healing journey.
The reason that it's important to give to the CAC is the reason that the CAC is so important. These things happen in the dark. I think the CAC is a model on the leading edge of community level and law enforcement response to child abuse. And without the support of donors, it wouldn't exist. There needs to be a centralized location for this sort of thing. There needs to be a centralized sort of hub for response to child abuse, because without that, we're all sort of in our own rafts drifting apart. So the CAC is what keeps us all together. They also provide critical services to victims that would not likely find those services otherwise.
Thanks to the funds raised through Courage, the CAC is working on expansion to these services, including social determinants of health screens to address resource needs, trauma and mental health screens, and expanding access to trauma-informed mental health care. Recently, the CAC multidisciplinary team was able to work together to meet the needs of a child who experienced pregnancy as a result of their sexual assault. The multidisciplinary team was able to work collaboratively to gather the critical information needed for the legal investigation, make joint decisions about the child's safety, and ensure connection to essential medical services, as well as provide much-needed support and community resources to the child and their caregiver. Without the CAC, the child may have been interviewed multiple times by different individuals, reliving their trauma, and their caregiver would have had to navigate a complicated medical and mental health system on their own. With our dedicated team members, we were able to make a very stressful and painful situation less difficult, so the child and her caregiver could focus on her physical and emotional healing. This is just one example of the work that the multidisciplinary team at the CAC does, and why your support is so critical. I cannot thank you enough for donating your time and money to support these services at Marybridge Children's. With your help, we are impacting the lives of the most vulnerable population in Pierce County every day.